Ehr Incentive Attestation. In this video, I'm going to show you how to attest to meaningful use in the waiting room solution system for the purpose of receiving your stimulus payment from the government. First, go to the Ehr Incentives Login screen showed on this slide. Enter your username and password, which are the same as used for your NPI registration. If you haven't already registered for the Ehr Incentive Program, refer to that video first. After login, click on the Attestation tab. Click on the Attest link next to your name. Next, enter the attestation period. You are expected to attest to a 90-day period. You will then be asked to input your meaningful use measure data for the 90-day reporting period, which will include a denominator value, a numerator value, and if you qualify exclusion under this measure. Before you can enter the data, you'll need to run the meaningful use report within the waiting room solutions system. Select the provider and the reporting period. Let's run the report for all measures. The report will then appear with that provider's results for the numerator population, denominator population, resulted percentage, and qualified exclusions. It's important to realize that the waiting room solution system can only report on patient data that is within the system. When you attest, if you have kept separate records, those can be included in your attestation if appropriate. For the 15 core measures, you will need to meet the minimum percentage to qualify. For the menu set measures, you'll select 5 out of the 10. For those 5, you'll need to satisfy the minimum requirements. You do not need to satisfy all 25 measures. Also, if you qualify for an exclusion for that measure, then you are not required to meet that measure's requirement. Now let's go back to the attestation page. Now I'm going to simply read off the Waiting Room Solutions report and enter the data on the attestation website. If you maintain all of your patient records within the Waiting Room Solutions system, then you can attest that your entry applies to all patient records. If a measure doesn't apply to your practice of medicine, for example, you are an ophthalmologist that doesn't routinely obtain vital signs, you can qualify for an exclusion and still qualify for meaningful use. Here we attest that our data applies to all patient records. The first exclusion asks if we see patients 2 years or older. We do, so this exclusion does not apply. However, the second exclusion applies as the eligible professional believes that all 3 vital signs have no clinical relevance to their scope of practice. Exclusion from this requirement does not prevent an eligible professional from achieving meaningful use. Now let's move on. We have now completed answering the 15 core measures. After completion of entering the data for the 15 core measures, you can then select 5 menu set measures to report on. I'll now select the 5 measures that I would like to attest to. It's important to remember that excluding yourself from a menu set measure does not prevent you from achieving meaningful use and collecting your payment. After the meaningful use measures, you will move on to clinical quality measure reporting. You'll need to first run the clinical quality measure report within the waiting room solutions. Select the provider. Name the report. Now select the reporting period. There are currently 9 clinical quality measures within the waiting room solutions system. These 9 measures will enable you to qualify for meaningful use irrespective of specialty. That is, you do not currently have to be concerned if these measures do not apply to your specialty or practice. Select all 9 measures. The report can then be accessed within the queue on that page. Here you can see the report details. It's important to remember that there are no minimum thresholds for the clinical quality measures. CMS is simply looking for the attestation. You will need to report on 6 measures, 3 core and 3 menu set. If the denominator population is 0 on a core measure, then you will need to attest on an alternate core measure. You are not being judged on achieving a certain minimum threshold. You simply need to report the clinical quality measure. Here the result is 0 patients in the population. Even if there were a denominator population with 0 patients achieving the numerator qualification, this does not prevent you from achieving meaningful use. When you are all done, you can review your entries for accuracy and make the final attestation. This completes the tutorial on meaningful use attestation to claim your stimulus payments.